Resolving power and limit of resolution. The term limit of resolution and resolving power refer to the smallest angle of separation between 2 points which allows the formation of two discernible images by an optical system. The limit of resolution is reached when two airy disks are separated so that the center of one falls on the first dark ring of the other. Tests of visual acuity or resolving power of the eye. It is important in clinical practice to be able to measure the resolving power of the eye. There are many tests of visual acuity. The more commonly used and important ones will be discussed. In young children, tests appropriate to the age and development of the child must be selected. As soon as the child is old enough, tests to which the response is behavioral should be replaced by those required matching. So visual acuity assessment in children remains a challenge for the ophthalmologist and needs to be correctly assessed for the early diagnosis of refractive errors, amblyopia and other ocular pathologies. However, lack of cooperation and comprehension in young children makes it a challenging task. Preschool children with lower visual acuity are usually unaware of their problem unless the defect is bilateral and severe. Parents are also unable to suspect low vision in their children, especially in unilateral cases. As a result, children with anisometropia and small angle strabismus usually have a delayed diagnosis. The American Academy of Ophthalmology and the American Association for Pediatric Ophthalmology and Strabismus recommend the vision evaluation in the newborn and at 6 months and at 12 months, at 1 to 3 years of age, then at 3 to 5 years, and then beyond 5 years. Normal visual acuity at birth is 6 by 120 or 20 by 400. At 4 months it becomes 6 by 60 or 20 by 200. At 6 months it becomes 6 by 36 or 20 by 120. At 1 year it becomes 618, and at 2 years the visual acuity becomes 6 by 6. The visual acuity milestones according to age are: at 29 weeks of gestation, the infant should achieve pupillary reaction milestone. Soon after birth, the milestone is blinking at light. At 2 weeks, the milestone is small saccades development, followed by horizontal moving objects. At 2 months, the fixation is well developed and also develops bifoveal fixation. So, at 3 months, the child reaches out for objects. At 4 months, sensory fusion and accommodation begins to develop. At 5 months, Meniere's reflex, which is blinking to visual threat. At 6 months, accommodation and fusional vergence well developed, stereopsis begin to develop. At 9 months, visual differentiation of objects. At 2 years, picture matching. At 3 years, picture and letter matching. At 5 years, stereopsis well developed. So, visual acuity assessment in various age group. In infants, the fixation normally should be central, steady and maintained. Fixation behavior and fixation preference testing can be described using CSM, which means central, steady and maintained notation. Fixation during monocular viewing is described as central or foveal, or non-central or eccentric. Steady fixation is or stable fixation, stable eye position, or non-steady, which means roving eye movements or nystagmus. Maintain means fixation that is held during binocular viewing after the opposite eye is uncovered during fixation preference testing. Meniere's reflex is a reflex blinking that occurs in response to a rapid moving object and visual threat. The reflex develops by 5 months of age. Much can also be detected from watching babies playing. The ability of a child aged 15 months or older to pick up a tiny colored hundreds and thousands sweets suggests near visual acuity equivalent to 6 by 24 or better in the absence of a serious visual defect. However, good near visual acuity may develop in the presence of high myopia. The CAT 4 drum. It comprises a wide cylinder which is marked with black dots. Here you can see the black dots of increasing size corresponding to visual acuity ranging from 6 by 6 to 2 by 60. When viewed from 60 cm, the drum is masked by a screen except for a rectangular aperture. This is rectangular aperture which exposes a single spot. This spot is made to oscillate horizontally and stimulates corresponding eye movement if seen by a child. The test overestimates the acuity both because the target is moving and because the test is conducted at a short working distance. Pursuit eye movements. Other methods for assessing visual acuity in pre-verbal children depends upon preferential looking and the measurement of visual evoked potential. Preferential looking can be used to assess the visual acuity of infants based upon their turning their head or eyes toward a pattern rather than a uniform target. A black and white square wave grating, alternate black and white strips, is presented simultaneously with a plain gray target of equal size and average luminance. Children with better vision are able to see a finer grating and turn towards it. Visual evoked potential are electrical responses generated in the occipital cortex by visual stimulation of the eye. The stimulus used is either a black and white square wave grating or a checkerboard pattern in which the pattern reverses at a set frequency. Testing of young children requires them to match the optotype letter or symbol. Testing of younger children requires them to match the optotype letter or symbol on a card shown by the examiner, who is 6 meters or 3 meters away, by pointing to one of the group of matching letters on a key card. Children aged 18 to 24 months may be able to perform a picture optotype test. The K-picture test uses pictures of objects such as cat, train, house. The Cardiff cards also use pictures. The Stryker letter tests use the letters first recognized by children, which are H, O, T, V, X, X, to test children up to the age of approximately 3 years. The Sheridan-Gardiner test uses 7 letters adding U and A. Optotype testing of the literate involves the naming of letters. The Snellen visual acuity test is the most commonly used. The test is based on the theory that smallest object which can be resolved by the eye subtend the same visual angle at the nodal point of the eye as a cone photoreceptor, i.e. 1 minute of arc. The test implies a chart with rows of letters of diminishing size. Each row accorded a number indicating the distance in meters, at which a person with normal visual acuity should correctly identify the letters. The bars and spaces of each letter subtend at angle of 1 minute per degree. The test chart is normally read from 6 meter or 20 feet. The subject who identify the letters on the 12 line from 6 meter has 6 by 12 vision or 20 by 40. The numerator indicates the viewing distance. Normal visual acuity is 6 by 6 or 20 by 20, although the young adults often achieve 6 by 4 visual acuity. Children are sometimes able to perform the test before 5 years of age and may be able to match the letters to a key card before 4 years of age. Logmar, which is logarithm of the minimal angle of resolution. Logmar visual acuity charts, for example, the Bailey-Love chart test, are more precise than Snellen test because they have a regular progression in the size and spacing of the letters from one line to the next and same number of letters on every line. Comparable results are therefore possible at any test distance. Vernier acuity. It is the smallest offset of a line which can be detected. It is measured using a square wave grating. An offset of 3 to 5 seconds of arc is normally discernible. This is less than the limit of Snellen visual acuity and is therefore also called hyperacuity. The near visual acuity test. The near visual acuity is usually tested at a distance of 25 to 33 centimeter. Near acuity charts usually comprise unrelated words or passages of texts. The British N system and the Jaeger system. The British N system is based on the use of typesetter's point system to specify the size of the metal block on which letters were traditionally cast. Each point is equal to 1 by 72 inch and blocks are sized in multiple of this. Blocks bearing in 5 letters measure 5 by 72 inches in height. Times Roman is used as a standard font because the size of printed text depends on the font chosen. The Jaeger text types are a less satisfactory alternative because they do not follow a logical progression in size. Potential visual acuity test. These tests may be used to assess the potential visual acuity of eyes in which it is not possible to see the macula, for example because of a cataract. Good potential visual acuity indicates that cataract surgery is likely to be of a benefit. The simple clinical test is the pinhole test. And there is blue field entopic phenomena is the ability to see moving white dots when blue light diffusely illuminates the retina. They are thought to represent light transmitted by white blood cells in the perifoveal capillaries. When this phenomenon is present, macular function is grossly intact. Interferometer. Project laser light from two sources on the retina. Laser light from two sources on the retina. The interference occurs when their two sources meet, and this is seen as a sine wave grating if the macula is functional. Potential acuity meter projects a letter chart on the retina through a small aperture. Contrast sensitivity. Tests of visual acuity do not adequately reflect the ability of the eye to see low contrast objects such as faces. In many conditions, cataract, glaucoma, optic neuritis, the visual acuity may be almost normal whilst the contrast sensitivity is considerably reduced. Contrast sensitivity is measured using a sine wave grating. This is a pattern in which there is gradual transition between alternate light and dark bands. The edges of the bands appear blurred, and narrower bands are described as having a higher spatial frequency. These are the narrow bands. A contrast sensitivity curve is constructed by plotting a range of different spatial frequencies against the lowest degree of contrast at which the eye can still detect the grating. Low or very high spatial frequencies must have higher levels of contrast in order to be seen. In clinical practice, The contrast sensitivity is measured using either a television monitor or a chart. The Paley-Robson contrast test chart displays letters that have decreasing levels of contrast to their background. The VCTech chart has 40 circles with different sine wave gratings and level of contrast. The subject must indicate the orientation of the circles. Glare testing: scattered light which reduces visual function is called glare. Glare may be the predominant symptom of the corneal edema or scarring, cataract, opacification of the posterior lens capsule. The effect of a glare source depends on its position and intensity and the light scattering properties of the ocular media. Glare testing refers to the measurement of visual function like visual acuity, contrast sensitivity, color vision in the presence of a source of glare. Polarization of light. The ordinary light waves vibrate in more than one plane, which is unpolarized. The polarized light may be produced from the ordinary light, and the polarized light individual wave motion are lying parallel to each other. So polarized light is produced from ordinary light by an encountering with a polarized substance, polarizing substance or agent. Polarizing substance, for example, are calcite crystals. Only transmit light rays which are vibrating in one particular plane. Thus only a portion of the incident light is transmitted onward and the emerging light is polarized. A polarizing medium reduces radiant intensity but does not affect spectral composition. Here you can see unpolarized light, and this is by polarizing filter it becomes polarized light. Light is also polarized on reflection from a plane surface such as water, if the angle of incidence is equal to the polarizing angle for the substance. The polarizing angle is dependent on the refractive index of the substance comprising the reflecting surface. At other angles of incidence, the reflected light is partly polarized, which, for example, a mixture of polarized and non-polarized light. Furthermore, the plane of polarization of the reflected light from such a surface is parallel with the surface. Most of the reflecting surfaces encountered in daily life are horizontal. It is possible to prepare polarized sunglasses to exclude selectively the reflected horizontal polarized light. Such glasses are of great use in reducing glare from the sea or wet roads. Without polarized lenses and with polarized lenses. By refringence, some substances have a molecular structure which transmit light waves lying parallel to its structure, but which selectively slows and therefore redirects light waves vibrating in plane perpendicular to the structure. Crystal of quartz have this property which is known as birefringence, because they split the incident unpolarized light into two polarized beams traveling in different directions. They have two refractive indexes. Dichroism molecular structure. Our dichroic substance completely block transmission of light waves not aligned with its structure by absorption. Only one beam of polarized light emerges, much weakened in intensity compared with the incident non-polarized light. Tourmaline and polarite. The polarite made from the fine iodine and quinine sulfate crystals embedded in plastic. They are dichroic substances, polarite being commonly used in sunglasses. Other examples of the use of Polarized light in ophthalmology are the assessment of binocular vision in which polarizing glasses may be used to dissociate the eyes. For example, in the Titmus test, in pleoptics to produce Hedinger bushes. Hedinger bushes are the entropic projection of Henle fiber layer in the polarized blue light. The third one is in the manufacture of optical lenses to examine them for stress. Next topic is stereoscopic vision. Stereopsis is the ability to fuse slightly dissimilar images which stimulate disparate retinal elements within Panem's fusional areas in the two eyes with the perception of depth. It is graded according to the least horizontal disparity of retinal images that evokes depth perception. It is measured in seconds of arc. The normal stereo acuity is approximately 60 seconds of arc or better. Slightly different values are quoted by different workers. An individual with very good stereoscopic vision may have a stereo acuity of better than 15 seconds of arc. A circle has 360 degrees, each degree has 60 minutes of arc, each minute has 60 seconds of arc. There are quite a variety of tests of stereo acuity available, but those most commonly used in the UK are the Titmus test, TNO test, Fresby test, and Lang stereo test. The Titmus test, which includes the weight fly test, is in the form of vectograph. A vectograph consists of two superimposed views presented in such a way that the light entering each eye is plane polarized. The light from one view being at right angle to that from the other. The composite picture must be viewed through a polarized visor or the polarized spectacles. The weight fly is the largest target in their test, which also includes graded sets of animals and circles. One of which is disparate and appears to stand forward. The test must be viewed at 40 cm and covers a range of stereo acuity from approximately 3000 to 40 seconds of arc. So the patient is shown a book with stereoscopic images, 3D and 2D images. The book typically contains a fly, animals and circles. The patient is asked to identify which images are stereoscopic, just ask the child which circle is jumping out or which animal is jumping out. So Titmus test is used with children to detect conditions like amblyopia where stereopsis is absent. The test can be challenging for children, so the optometrist may ask them to describe the fly, touch its wings, or indicate where it stands out in space. The fly, a large stereo fly with a variable stereo from the head to thorax. The fly is mainly used for screening. Circles, a series of rings that test from 800 down to 40 seconds of arc. And animals test for children that uses animals with disparities from 400 to 100 seconds of arc. A stereo acuity of better than 250 seconds of arc is said to exclude significant amblyopia, while a stereo acuity of worse than 250 seconds of arc may be an indicator of amblyopia. In the test of stereo acuity is Fresby test. It consists of 3 clear plastic plates of different thickness. On each plate there are 4 filled with small random shapes. One square on each plate contains a hidden circle, which is printed on the back surface of the plate. The random shape gives no visual clue to the edge of the hidden circle, and the test is purely three-dimensional and does not require polarizing or colored glasses to be worn. At a 40 cm the viewing distance, the plates show a disparity of 340, 170 and 55 seconds of arc, and by adjusting the viewing distance, the test can be used to give a disparity range from 600 to 15 seconds of arc. So this is a Frisby stereo test that measures stereo acuity, and by presenting a patient with series of transparent plates with a target printed on one side and a similar pattern on the other. Have the patient sit in the chair at eye level with the examiner. Place the plate on a fold down flap that provides a clear background. Hold the plate few centimeters above the background. Ask the patient to point to the center circle that appears to protrude the farthest. Repeat with other plates, recording the distance between the plate and the patient's eye per each. Check the patient understanding by slowly twisting the plate while keeping it about 10 degrees either side of square to their line of sight. So there are three plates of different thickness: 6 mm, 3 mm and 1.5 mm. And the plates can be presented at different distances to create a range of disparities. Test can be repeated without the patient learning the correct response. It does not require special glasses. The Lange stereo test targets are made up of fine vertical lines. This is actually a TNO test. So this Lange stereo test is wrong. The TNO test comprises computer generated random dot analog graph, and analog is a stereogram in which two disparate views are printed in red and green respectively on a white background. So this is actually Lange stereo test. Targets are made up of fine vertical lines which are seen alternatively by each eye when focused through a built-in cylindrical lens elements. The displacement of the random dot images, there are random dot images, creates disparity ranging from 1200 to 550 seconds of arc. Test card must be held parallel 1200 to 550 seconds of arc. The test card must be held parallel to the plane of the patient's face to avoid giving uniocular glue. Test is viewed at a normal reading distance. The Lange stereo test is a glasses-free test that measures stereopsis or 3D vision. Ensure the subject is wearing their corrective lenses. Position the examiner in front of the subject so that they can observe their eyes' movements. Hold the test cards at a reading distance of 30 to 40 cm. At a right angle to the subject, ask the subject if they see anything on the card. If the subject detects a 3D object, ask them to describe it and look for other objects. Ask the subject to point to the figures and indicate which one sticks out the most. The result of the test can be positive when the subject has intact stereo vision. The result of the test can be negative when the subject did not recognize any of the test figures. The result of the test can be uncertain when the subject was only able to recognize and name part of the test figures correctly. The TNO test. The TNO test, stereo test is a random dot stereogram that uses red-green glasses to evaluate stereopsis. The patient wears red-green glasses to separate the images presented to each eye. The patient looks at a series of plates with hidden test items such as discs with a missing sector. The patient must guess the location of a missing quadrant in two consecutive circles to progress to the next level. Plates 1 to 3 are screening plates with images like a butterfly and a geometric form. Plate 4 test eye suppression. Plate 5 to 7 quantitative plates with up to types shaped like discs with a missing sector. The test measure disparity values from 480 to 15 seconds of arc, while the Lang stereo test range was 1200 to 550, and here it is 480 to 15 seconds of arc in 5 steps. TNO stereo test is available as a book or with a stereo viewing glasses for children or adults. So TNO test, stereo test is performed at a distance of 40 cm while wearing red-green Eneglip stereo glasses. The child is first shown plate 1, in which 2 butterflies are presented in a random dot stereogram. One is only visible when both eyes are used, reducing the likelihood of monocular cue.